Hi, everyone. My name is Jose Zevallos. I'm the Division Chief of Head and Neck Surgery here at WashU and the Director of our Advanced Head and Neck and Reconstructive Surgery Fellowship. I want to welcome you to our program. Unfortunately, we are unable to see each other in person right now, but I know we'll have some Zoom interviews coming up and hopefully some in-person interviews later in the summer and the fall. So once again, welcome to our fellowship program. And to the application process for the 2021-2022 academic year. Here in this picture, you can see our medical campus in Forest Park in the foreground here. So our fellowship, the goals of our fellowship are to train academic head and neck surgical oncologists who have superior proficiency in both ablative head and neck surgery as well as transoral surgery, and who are facile and expert in complex head and neck cancer reconstruction. We hope to train surgeons in the multidisciplinary management of head and neck cancer, something that we value here tremendously, and also to train the future leaders of head and neck surgery for the future. Our legacy is built upon giants, one of whom is Dr. Joseph Agura. You can see a picture here of Dr. Agura with his pipe. Some of the pipe stains are still on the roof of some of the offices here at WashU. Our group is comprised of 6 head and neck surgeons at Barnes Jewish Hospital. Myself, Dr. Peniello, Dr. Jackson, Dr. Rich, Dr. Pipcorn, and Dr. Purim. Dr. Purim recently joined us last year from Ohio State. He does the full depth and breadth of head and neck microvascular reconstruction. Dr. Peniello specializes in partial laryngeal surgery and laryngeal reinnervation, complex airway reconstruction. Dr. Jackson does the majority of our transoral robotic surgery for HPV positive and HPV negative head and neck cancer, as well as some TORS surgery for sleep. Dr. Rich has a practice that's comprised primarily of advanced head and neck skin cancer, including melanoma, squamous cell cancer. He also has an interest in TLM and complex airway reconstruction. Dr. Pipcorn does open and endoscopic skull-based surgery and is a busy microvascular surgeon. Dr. Massa was our fellow last year. He is at the VA Medical Center and does the full depth and breadth of head and neck surgery. We also have 2 endoscopic skull-based surgeons who work with our fellows based on cases and interest. In terms of our numbers, we have a very busy fellowship. As many of you know, we are going from 2 fellows to 1 fellow. And the primary reason for that was to make sure that we train 1 fellow with the maximal experience, that each of our fellows receive access to every single case we do. As you can see from the numbers, we have adequate volume for 2 fellows, but I think going down to 1 fellow for now will provide among the very best training experiences in the country. So you can see our numbers here of microvascular and TORS cases from July 2019 to May 2020. That's about 10 months. And you can see in those 10 months, we've done 202 free flaps. We've done radial forearm flaps, ALTs, fibulas in high numbers, as well as scapular system flaps. The lateral border and scapular tip flaps are our go-to secondary bony flap. You can see we've also done a share of other flaps, including rectus, lateral arm, TPF free flaps, and latissimus dorsi flaps. Our fellows in that 10-month period did 50 TORS cases combined and 2 TLM cases. So our projection for the academic year is about 220 to 240 free flaps and about 65 TORS cases. This volume, we expect to increase even more. It's gone down a little bit because of the COVID crisis in the last month and a half. So as I mentioned, our group, what we value tremendously as part of the WashU Head and Neck team is our multidisciplinary nature. In addition to our 7 head and neck microvascular surgeons, we have 3 dedicated radiation oncologists led by Dr. Thorstad. We have 3 head and neck medical oncologists led by Dr. Atkins. Linda, Neal, and Kelsey Rosenquist are our speech therapists. Dr. Chernock and Dr. Mansour are our head and neck pathologists. Dr. Boleg and Dr. Stepan are our current fellows who are off to do great things next year. Dr. Mazul is a cancer epidemiologist that works with our division, and Dr. Major is a proteomics person PhD scientist that we just recruited from UNC and who joined us not long ago. So what the fellowship responsibilities include is an instructor level appointment in the department, faculty level privileges, and you take faculty level call just like me and everybody else in the faculty. This is 1 day per month and 2 weekends per year. Our operative experience is very busy, 4 to 4.5 days in the OR. I expect that with one fellow, this will look more like 4.5 to 5 operative days per week, primarily at Barnes. There will be some coverage at St. Louis Children's on occasion, and possibly coverage at the VA or free fluffs as well. Clinic will be 0.5 clinic days per week to 1 clinic day a week, depending on cases. The other responsibility that we see is participation in our head and neck multidisciplinary clinic. This is a unique clinic where 5 patients per week are seen together by the head and neck surgeon, the medical oncologist, and the radiation oncologist to make decision planning, usually around clinical trials and treatment with surgery versus radiation therapy. We also expect that the fellow participate as a team leader and oversee the head and neck ward and the residents. We also asked the fellow to participate in didactics. The fellow will give 1 grand rounds during the course of the year. He or she will participate in head and neck tumor board, which occurs once a week, endocrine tumor board, which occurs twice a month. And we've asked the fellows to run a complex case conference, which is meets once per month, where the fellow will present complex cases to the residents and to the attendings for discussions about planning and implementation of the plan. We also participate in the head and neck cancer curriculum put out by the American Head and Neck Society. A big part of learning how to be a head and neck surgeon is learning how to teach appropriately and well. And we expect that our fellows will teach the otolaryngology residents about all aspects of head and neck cancer, participate in the core curriculum for the residents, and supervise the residents in the operating room as well as in inpatient management. We are very proud of our fellows, and they have all been excellent teachers for our residents, and it makes the resident experience even more valuable. Research-wise, it's a busy fellowship, but we do expect that you participate in some level of research. We have multiple options within our group, including clinical outcomes research with Dr. Jackson, Dr. Rich, Dr. Pipcorn, Dr. Picarillo, translational research in my lab, Dr. Perham's lab, Dr. Paniello's lab, epidemiology research, and our goal is 1 publication and 1 national presentation from the fellowship year. So where have our recent fellows gone? We're very, very proud of our recent group. If you look back going to 2018, 2019, in that year we had Dr. Massa from SLU and Dr. Risby from UCLA. Dr. Massa is now an assistant professor in our department at the VA hospital and doing very well. Dr. Risby is an assistant professor at the University of Washington and also off to a great start as a faculty member. Our current fellows, Dr. Stepan and Dr. Bolig. Dr. Stepan is headed to Northwestern as an assistant professor in head and neck microvascular reconstruction in July. And Dr. Bolig is headed to Robert Wood Johnson to work at Rutgers, and we're very excited for him as well. Our fellow for this coming academic year is Burton Wood. He is currently a resident at Vanderbilt, and we're expecting that he's going to be very busy and a very successful fellow as well. So I want to thank you for your attention and for your interest in our program. We are very proud of this group. We are very excited as we continue to work hard and look forward to training our future fellows here at WashU. If you have any questions at all, my email is here. Please reach out and I'd be happy to talk. Thank you very much and good luck with the fellowship application process.